We want to spend £450 million to improve acute hospital and maternity services in Leicester, Leicestershire and Rutland. This means the services provided at the Leicester Royal Infirmary, Glenfield Hospital and the General Hospital. We want to see improved patient care, better patient outcomes, and have staff working in the best place to make this happen. Most of all, we want to deliver hospital healthcare that is fit for the future. This is your chance to find out more about what is being proposed and have your say. This will help your local NHS understand what the changes would mean for you and help us make the final decision.
What we don't want is a health service that's designed only by the people who work in it. It's got to be designed by the people who experience it and use those services.
The proposals include 2 super intensive care units, one at Leicester Royal and one at Glenfield Hospital, with 100 beds in total. That's almost double the current number. Modernised wards, operating theatres and imaging facilities. The first dedicated single-site children's hospital in the East Midlands, based at the Royal, and a new maternity hospital. Currently there are 2 units on different sites, the General and the Royal. Under our proposals, Glenfield Hospital would become a major planned care treatment centre, with welcome centres to put you at ease and help you find your way around the hospital. These changes would enable us to separate emergency care and planned operations. This would help prevent treatment being delayed or cancelled when the emergency services are busy. More than 100,000 day case procedures and around 600,000 follow-up appointments take place every year at the city's hospitals. The move will free up capacity at the Leicester Royal Infirmary and help ease issues of access and parking there. Leicester General Hospital will become a community health campus. It would include facilities such as a Diabetes Centre of Excellence, a dedicated imaging hub to help GPs diagnose patients' conditions quicker, and a stroke recovery service with inpatient beds. It would potentially be home to a midwifery-led unit, which will be relocated from St Mary's in Melton Mowbray. This will make it accessible to more people and provide a better and safer experience for mums. At the moment, our hospitals and our staff, while doing their best, are spread too thinly, trying to provide 21st century services in outdated buildings with limited resources and opportunities for change. We want to achieve a service based on our future healthcare needs, not the legacy of the past.
Leicester's hospitals merged in 2000, and whilst that merger was very successful, it left one issue unresolved. And that was that many of our clinical services, the location of those clinical services is more a product of accident than design. They're split across more than one site. Our staff are spread thinly and our equipment isn't always in the right place. And that can lead to difficulties with staffing our services in the way that we would want to do optimally. I'm really excited by these changes. I think that this is a once-in-a-generation chance to provide care in Leicester, Leicestershire and Rutland that will be state-of-the-art, will give patients a much improved patient experience, give them access to modern medicines, modern treatments in modern buildings. And I'm really excited by this, and I hope that people will be when they see the plans of what we're planning to try and do for Leicester, Leicestershire and Rutland.
You can see the proposals on our website and fill in a questionnaire to give us your views.